so much. I'm so happy to be here to talk about what can be self-tested now. I have no conflicts to declare. So as we talk about self-testing, I think it's important to situate it in the broader definition of self-care, which is the ability of individuals to promote health, prevent disease, maintain health, and cope with illness and disability with or without support of a healthcare provider. And it's within this context that self-testing and the range of options is really available and why we're including it. And we've really seen across disease areas that there's evidence that self-care and self-testing, these approaches are critical to the health system as they increase engagement and autonomy, increase access and equity, improve quality, increase efficiency, reduce costs to the health system and individuals, and expand universal health coverage efforts. So we've come a long way with self-testing guidance starting in 2016 at WHO with HIV self-testing recommended. And since then, we've had recommendations on HPV self-collection, self-collection for syphilis and trichomonas. We've also had recommendations for hepatitis C self-testing and self-collection for gonorrhea and chlamydia. And then most recently, recommendations around COVID-19 self-testing, the ability to use self-testing for PrEP initiation, reinitiation, and continuation, which is being launched at this conference, as well as new guidance around self-testing for pregnancy and proteinuria. There's forthcoming guidance we're going to talk a little bit about around syphilis and dual HIV syphilis self-testing, which is an exciting new area. And broadly, what I would say is that with all of this guidance, we're starting to see scale up, particularly for HIV self-testing and COVID-19 self-testing. But it is important we redouble our efforts to increase access. So why we do self-testing, this is a framework we developed particularly around HIV that can be adapted to other disease areas now. That as we focus on reaching people with risk, self-testing can be an important way to engage people in treatment who may not have access otherwise, as well as relinking them. It has an important role in the scale up and linkage to prevention interventions. And importantly, it has a role in triaging people out of the health system. So creating kind of an adaptation where we can save health worker time and reduce the burden on congested health facilities. So now I'll walk through some of the core evidence around each of the areas we have recommendations for. So first, on HIV self-testing, we've got lots of evidence, more than 32 randomized control trials and over 150 values and preference studies. And based on this, we have evidence that really highlights that it's safe and accurate, highly acceptable, that it increases access and frequency to testing, achieves comparable linkage, and absolutely increases the number of HIV positive diagnoses. And we have new evidence now that highlights that self-testing can play an important role for differentiated service delivery. And this can be for oral tablets as well as for the dapivirine ring. And in the future may include things like HAB-LA. So an important opportunity for using self-testing to really increase access to both treatment and prevention. For hepatitis C self-testing, this is another area we have guidance released in 2021 as a really important way to increase equity and accelerate elimination goals. So again, this is being shown across studies as very acceptable and feasible, that it may be more costly than standard facility testing, but achieves greater diagnoses overall, which is critical for the elimination agenda. And we see that there's ongoing work to optimize hepatitis C self-testing delivery that we have to prioritize, but really strong approaches here, especially because hepatitis C is an area where we can provide a cure to people, that self-testing is a really great fit and an important approach to prioritize. Now, syphilis self-testing, as I mentioned, this is guidance we're working on developing now. And so I wanted to highlight one randomized control trial that was published earlier this year that in China showed men who have sex with men had increased use of self-testing compared to standard testing, that self-testing really reached a substantial number of first-time testers, and that the cost was much more affordable, as well as it being acceptable and feasible. So WHO is doing a systematic review, but this will be an important area to watch as we increase the range of self-testing approaches for different disease areas. Now, COVID-19 self-testing, this is an important approach, and I know many of you might be familiar with it and having done it just before coming to this conference. So there's good evidence that we see that this is accurate, that we can achieve good uptake and reach people who wouldn't test otherwise. And it can have social benefits like reducing the need to isolate or the time of quarantine, as well as contribute to reduced absenteeism from work or other important activities. And we've really seen a lot of countries take this forward in high and low middle income countries, and that it is an important space that we continue to optimize, especially as we have new test and treat opportunities for those who are vulnerable to severe disease. Now, STI self-collection and self-sampling, again, a very important approach. We see here it's really about prioritizing the approach to case finding and ensuring that we can reduce costs. This is a really critical space to have community-based programming, and it can be really leveraged for empowerment. And so really an area that we could probably see a lot more going on with STI self-collection, self-sampling, and in the future, even self-testing for some. And then we also have self-testing in the context of pregnancy. This might be one of the first self-tests was the self-test for pregnancy that has now really been shown to be effective, to be a low-cost way to improve equity and enable women to know about their pregnancy as soon as possible. And there's new guidance now around self-testing and clinic-based testing for proteinuria, which really highlights that this could be a consideration for women to increase empowerment, ownership of their care, and decrease their clinic visits. So more studies needed on the benefits of self-testing in pregnancy, but lots of opportunity here as well. Now, I wanted to touch on how pricing really impacts access to self-testing. And here's just one example from HIV. Early on in 2012, HIV self-testing in the US market was available for about $40 in the private sector and $4 to $5 for low and middle income country research. And over the course of time, with investments and partnerships from donors and other stakeholders, we've really now been able to achieve a $1 self-test, which is an exciting announcement we can make at this. And this is really going to improve access overall. Now, for COVID-19, we also have seen that there's a variety of different pricing points, and this is a challenge because we might have some settings where self-testing is free or at some time points where it's free, but not free to all. And this is an important challenge if we're trying to increase access to testing moving forward. So an important consideration when we think about the role of where self-testing might be happening. So I just wanted to leave you with a few takeaways. So one, self-testing is the new normal, and we are seeing many disease areas really benefit from self-testing and self-care models. And there's lots of lessons we can really leverage from HIV. So it's really the time now to accelerate national policies, manufacturer development, and access to affordable products. Now, in terms of program priorities to really go to scale, we have to really shift away from individual disease-specific self-testing regulations and registrations to policies and platforms that are more cross-cutting. Virtual interventions are definitely one of those that are a priority. And it's now time to really leverage the indirect evidence that's available because we don't need to reinvent the wheel, and we can really expand self-testing access across different areas moving forward. It's really the time now to redouble our efforts. We need the scale up of domestic and donor funding to prepare for the future of testing, which is self-testing. And lastly, we can't really have self-care and self-testing without advocacy and community engagement. We have to have the right messages out there, the right support systems, and the role of the community is something we really need to prioritize moving forward. So I just want to thank the team for their contributions, and I've left my email here for any questions, and I'll thank you so much for the time and look forward to the remaining presentations.